Lowering your blood pressure lowers your risk of heart attack. And having a good blood pressure is the most important thing you can do to lower your risk of stroke. Normal blood pressure is less than 120 over 80, not less than 140 over 90 as we used to think. The first number, the higher number, is called the systolic blood pressure. The second number, the lower number, is called the diastolic blood pressure. If the systolic blood pressure, the first number, the higher number, is 120 or greater, you are at increased risk of stroke, heart attack, heart failure, and kidney damage. If the second number is 80 or greater, then you face the same increased risks. Everyone, including those at low risk, needs to work to get the blood pressure as low as possible. The goal is to get the top number below 120 and the bottom number below 80, because the risk of heart attack and stroke goes up when the blood pressure is 120 over 80 or greater. If the top number is 120 or greater, the systolic blood pressure, or the bottom number is 80 or greater, diastolic blood pressure, you should practice the healthy living habits to lower your blood pressure. The healthy living habits include modest weight loss, the DASH low sodium eating plan, daily exercise, limiting your alcohol consumption, and being careful about over-the-counter medicines you take. If you're overweight, weight reduction of only 20 pounds can lower systolic blood pressure by 5 to 20 points. The DASH low sodium diet can reduce your systolic blood pressure by 8 to 14 points. And following the DASH low sodium diet will reduce your salt consumption. Regular exercise, like walking 30 minutes a day, can lower your systolic blood pressure by 4 to 9 points. Limit your alcohol consumption to no more than 2 drinks per day for men or no more than 1 drink per day for women. And 1 drink means 1 12-ounce bottle of beer or 1 5-ounce glass of wine or 1 1.5-ounce drink of 80 proof alcohol. All three have the same amount of alcohol. By limiting your alcohol consumption to no more than this amount, you can lower your blood pressure by 2 to 4 points. Finally, some over-the-counter medicines can raise your blood pressure. Daily use of medicines like Motrin, Advil, or Aleve can increase your blood pressure by 5 points. Prehypertension is a systolic blood pressure of between 120 and 139, or a diastolic blood pressure of between 80 and 89. People with prehypertension are at increased risk of heart attack and stroke. Hypertension is a systolic blood pressure of 140 or greater, or a diastolic blood pressure of 90 or more. People with hypertension are at increased risk of heart attack and stroke. Everyone with prehypertension or hypertension should treat themselves with the healthy living habits, which are also called lifestyle modification. People with prehypertension and diabetes or kidney disease should take medicine to get their blood pressure below 130 over 80. People with hypertension should take medicine to get their blood pressure below 140 over 90. Many people with high blood pressure need to take 3 or even 4 or more different blood pressure medicines to get the blood pressure down to a safe level. Many people are afraid of the side effects of taking that many different medicines. But the side effects of high blood pressure can be much worse: a preventable heart attack or stroke. Well, that's it for now. Thanks for watching, and I hope you found it useful.